Medtronic have very kindly supported for primary care healthcare professionals the development of a one-page summary summarizing which patients may benefit from consideration of early catheter ablation. This has been very well received by colleagues in the UK and can be easily downloadable for any healthcare professional by going to the referring physician website, part of the Medtronic website, or via the QR code on the screen. Now, Diraj, symptoms often reinforced as an important indication, seems to be a crucial indication for consideration of ablation. But Diraj, do we have to be a little careful here? Because many patients adapt their lifestyle to suit their AF. Is there any role, for instance, for cardioversion to gauge whether a patient improves symptomatically from reverting to sinus rhythm and therefore potentially unmasking a potential benefit from an ablation procedure?
Absolutely, you're right. So there have been several studies which have shown that catheter ablation improves quality of life even in asymptomatic individuals. And the reason why it does that is that you're absolutely right that patients are often labeled as being asymptomatic, whereas in actual fact, they may have so subtle symptoms that they are not picked up by a cursory conversation with the physician. And if you were to ask them to fill in a validated quality of life questionnaire, you will actually identify that they have got symptoms. They just perhaps ascribe them to being unfit or becoming older, and they just don't realize that it was the AF which has actually resulted in the quality of life deterioration. And cardioversion is indeed a very easy and a very effective way of teasing out the contribution of AF to the symptoms. So once I have patients referred to me for atrial fibrillation management, where their symptoms may perhaps be either absent, or I'm not sure how much of the symptoms are because of atrial fibrillation, I would cardiovert them and then assess their symptoms improvement or lack of. If they have improvement, then according to every guideline, they should be off for catheter ablation.